All right, against Dr. Buford, we're just getting started on the right shoulder. We're looking at it from the back to the front. Everything that we see is magnified 30 or 40 times on the screen. Right now, we've just got two cannulas coming in the front of the shoulder, this gray one and the metal one to the left of it. And then to the left of that is, hold the camera please, is our biceps tendon right here. As we tug on it, it looks fine. We'll look down at the biceps anchor. There's a little bit of cracking there, but that's really not a detachment that we have to worry about as long as we address the instability. Your shoulder was unstable under anesthesia, so we confirmed the diagnosis. Your rotator cuff is at the top of the screen here, and that looks good. And then as we look towards the back of the shoulder, posterior labrum looks reasonable. Posterior capsule, we're going to probably have to put a suture anchor in the back, but we'll get to work on deciding that in just a minute. As you look down the front of the shoulder, we can see again, you have this look of multidirectional instability. So we'll get some what we call why not suture anchors and get to work on fixing this. We're going to start in the back of the shoulder first, though. Pause, please. Okay, we're using this instrument called a rasp just to roughen up some of the soft tissues here so we can help reconstruct the labrum and tighten up this capsule. Okay. And now we've got to check our insertion angle and see if we can get a suture anchor in through the yellow cannula. If not, then we'll do it through a separate stab incision. Pause, please. Okay, so we've got a suture anchor down. You can see the two sutures. We'll tug on it. That looks very solid. We're going to go ahead and hand one of these out to the front. Like that. And then we'll take what we call a turn to the left suture hook. This is it here. It's loaded with a black wire, like that. And we'll start here and just the capsule. We're going to come through twice and do what we call a figure 8 stitch. This is the first part of that. So there we are, right there. So take the grasper. Let's see. And then outside your shoulder, we're going to load that black wire with the suture. See how that looks. So I think we'll do a regular mattress stitch here, which means that now we're going to take the other suture out. Pinch it. So we'll take this, pass it like that. Okay, and now we're ready to do step 2. Here. got a mattress stitch here that we can tie. Make sure there's no twist. So now we'll go ahead and tie this knot. We'll show you some more in a minute. Okay, so here's the mattress stitch in the back where we've built up the poster labrum. That looks good. You can see right there. And now we're going to do a lot of work in the front to try and accomplish the same thing. Pause, please. Okay, so now we're working in the front of the shoulder. Right where the tip of that instrument is, this is the band that we're going to try and tighten up. That's the anterior band of the inferior glenohumeral ligament. And there really isn't anything well defined there at all, so we're going to be working on that. Pause. Good guide. Let's get this knot. You can get one more, why not? Because I'm sure we'll either ruin this one or need another one. Let me turn this. Drill. Okay, here we are getting ready to place the drill. And then the next step is to go ahead and place the implant. That's it going down. Pause, please. Okay, here we've got that in. It's very solid. Now we're going to reach in and get one of the sutures here. We will take a turn to the right suture hook this time. So here it is. We'll start here. Coming through. Pause. Okay, so now we've got that part through. We're going to do the same thing one more time here. That through. Pause. Okay, so we've got that knot tied. That looks good. We're going to place one more to try and further strengthen this anterior capsule. We're going to place this one right about here. Okay, so this one's very solid also. You can see I'm pulling the whole shoulder when I pull on the sutures. And now we'll reach in here and take out one. And do the same steps that we showed you with the first. So we're going to reach in here with our hook. Start down here. Just see the tip of it coming through. Back and come underneath. Up there. Okay, we're just cleaning up the front. It looks great. You can see that great solid wall of labor on the left side of the screen now, where we reconstructed it. Okay, see how much better that looks? Look at that big wall at the tip of the instrument. Of course, we put that one stitch in the back. So we are going to finish up here and get you back to the recovery room in just a few minutes. I really hope this does the trick for you. Okay? Good luck to you now. Bye-bye.